silent intentionally for the last 2 months on a number of issues because we don't want to unnecessarily cause headlines. And I think the silence was deafening, as they say, because of so many questions, in the public domain that remain unanswered. And I suppose somebody has to answer them. From our point of view, this vaccine, from the time it was in its clinical stages, was associated with different levels of efficacy, neurological issues, and now this business of blood clots. What I always maintained is that let the investigators and regulators investigate the matters and then come to their logical conclusions instead of, going by what, is being said in the media or what manufacturers claim is happening. So what we saw that the Ministry of Health in India, the WHO, the EMEA and other countries have said that this vaccine is perfectly safe. In fact, even with this recent matter of blood clots, I never wanted to make a statement because next week you're going to hear the conclusion to what is happening, and we should wait for that. Because what really needs to be established in any adverse reactions or other severe adverse events, as they're known as, that is there a cause and a link, and is it statistically significant where the risks outweigh the benefits? Certainly here, the quantum of blood clots that have happened, we have to still establish and see if it's vaccine related based on the fact that, blood clots is a normal phenomena in a given population of age and comorbidities. So we have to see whether the vaccinated group of people in these countries have found a higher incidence of blood clots compared to those that aren't. And is that even statistically significant? That is your starting point. Then you have to go into establishing whether there's a link between the two, because there still could be many factors. So let's wait and see what happens. So far, we've seen that there's no issue like that here associated with the vaccine. The vaccine is providing excellent safety and efficacy. Everybody I talk to, and we've seen that with their own public announcements. In fact, the real testament is that everyone who's been vaccinated, not even 2 or 3% of those people who have got COVID-19 have had to be hospitalized. So we're seeing that 90 plus, 94% plus efficacy with even one dose of Covishield in India, which is actually validating what was seen in Scotland Public Health with their study that they've done, which will be published in Lancet and is already on their website, which has happened in more than 400,000 people as a study with one dose of safety and efficacy, after which, and that's the right way of doing it, those regulators have continued things going, including the EMEA has not suspended or banned Oxford AstraZeneca. WHO has said it's safe and should be used. EMEA has said it, and the UK MHRA has said it. Now, they can't all be wrong, including the Health Ministry of India, who has analyzed and looked at, more than 100 million doses that serum has delivered to India, right? And I think 7 crore doses, jabs have entered human beings in India. We've not seen anything serious. Is that, look, all vaccines traditionally will not enhance or be detrimental to, people in those conditions unless they have certain conditions where they, have a problem with their immune system, which can't make antibodies and respond to a vaccine in the same way in which they can't respond and make antibodies to a genuine virus that has infiltrated their system. Their immune system is compromised because they have these disorders, or, for example, if they're taking drugs for cancer patients to suppress their immune systems. So naturally, the vaccines are not going to be so effective in their cases. Now, does it enhance their disorders? Does it have safety issues? I don't know. It could not. I just would not be in the position to answer such a question. It wouldn't be right for me to answer. But yes, I would definitely say that those patients who are on those drugs and or have those autoimmune disorders may not respond as well to the vaccine as a healthy individual like you or I might do. So by not opening it up to the private market, we protect the vulnerable and give the priority-based vaccinations. Now, that is good for India and the people of India, perhaps not so good for the vaccine industry, which hopes to make a reasonable profit and return to innovate further, ramp up capacities, and kind of earn the revenues that foreign companies can do. But however, we are working with the government at this stage, at this price point, at this supply point, to take care of Indians first. That is, after all, our priority and responsibility. So, to answer your question, for a temporary period of 2 to 3 months, we have fully accepted the request from the Modi government to maintain this price and to prioritize the supplies to India. Now, if it's for a temporary period of time, that's okay. The vaccine industry has enough time to make its profits in the next few months and export obligations, etc., etc. However, we hope that it is a temporary period of time, because then it's not so good for everybody. So this is the service that we are providing as a vaccine industry to the nation in this time of crisis. And to answer your second part of your question, we will see a major ramp up of serums facilities and other vaccine producers from the month of June onwards. Until then, we're going to see the kind of volumes that we're seeing today. Making 4 to 5 crore doses a month in January. Now we're making 6 to 6.5 crore doses on a monthly basis from this month. This was the plan and what we could get out of the existing buildings that we dedicated to COVID, which was not impacted by the fire. Later on, we explained to everybody that the ramp up and expansion plans, which we hoped would be available by the end of April in terms of supply, or May even, has now been pushed back till the end of June. Because the additional filling line did get damaged in the fire. And so, it's not a total write-off, it's just a delay of 2 months. And we were very lucky. Otherwise, the new additional facilities that we're planning to bring online with the government's help, and we've submitted a proposal for aid from them. And if we don't get it from them, we'll still remain committed and go to the banks. That plan has been pushed back by 2 months. So that, I hope, clarifies the statement I made about the fire, which happened on the 21st, sadly, of January.
So, from what I understood of what you just said, you're producing 6 crore doses. So, this is 6 crore vials or 6 crore doses? Because each vial has 10. Yeah. So, 6 crore doses of the COVID vaccine at this moment, and you hope to scale up significantly by June. When you say scale up significantly, this 6 crore will become how much in every month?
10 to maybe 11 crores on a monthly basis. So in January, I think when we had this discussion, we were applying to the regulator in India to start the bridging study of Covax, just like what we did for Covishield. Similar size bridging study with, the vaccine arm and the other comparator and others. So to do an immunogenicity bridging study. Now, that went a little bit up and down and had some delays, in getting the permission going and discussions that we were having, because we wanted to get it right. We didn't want to start a trial and then have issues. So that has finally now started, as I publicly announced. And hopefully by September, maybe October at the latest, we hope to get licensure in India. That's where we are at the moment. And we will start to stockpiling some vaccines like we did for Covishield ahead of time. To answer your second part, the global efficacy trials of Novavax have shown 89% efficacy overall, and also good efficacy, and I don't know exactly how much, maybe 50 to 60% against, the South African and the UK variants. Maybe a little bit better against the UK variant as well. But let me tell you, both Covax and Covishield, at the cost of repetition, has more than 94 to 95% efficacy against hospitalizations. In fact, in some countries, it is 100% effective against hospitalization. that study is ongoing in the sense that we're observing, as you mentioned, this UK variant, which has now started to really spread in our country. And we're already getting data of the people who have taken Covishield, 1 dose and now some of them 2 doses, who have got the UK variant, because with genomics you can tell whether it's the UK one, Wuhan, whatever. And I think if you ask me this question in a month, we would have a real picture of thousands of people who have got the contrived the UK variant disease, who have already been vaccinated and hopefully not had to enter hospitals. In some cases, yes, it does prevent it if it's not a heavy infection. But in most cases, we've seen you've got Covishield or the Pfizer vaccine or so many other vaccines globally. You still get the disease, but 95% of the time, you don't go to the hospital. Now, hopefully, we're going to see this trend continue even for the UK variants and for the South African variants. So far, what I can say with confidence is I have not seen anyone getting the UK variant disease who has been vaccinated and still ending up in hospital. So far, that is the silver lining. But to conclude this beyond reasonable doubt, we should wait at least another month or two till we see enough people getting the UK variant as a disease who have been vaccinated, and then observing how severe the disease progresses in their body. The longer gap you keep, it gets your body an opportunity to develop antibodies in a different way, and you don't block yourself from the first shot. I could explain this in detail, but perhaps not today on this show. The point here I'm trying to make, I stand by that statement. And as the Indian regulator sees more data, and it wouldn't be fair for me to make a statement and then say, oh, why is the Indian regulator not doing it? They need to see the data coming about, which they are. And that is why, the committees that decide on these things, rightly so, increase the gap, from the original gap that you mentioned was there between 4 weeks and now it's 8 weeks. And we're slowly, as we get more data in India as well, and other places, going toward that 3-month gap that I had originally hoped that we would have here as well. But we're moving toward that in that direction. Very good. I'm so happy you asked that. So as I explained earlier, that's why I called it Covishield. It's not a bulletproof vest. Imagine if you're shot with a gun. The bullet, when it hits your bulletproof vest that is supposed to protect you and save your life, is only a shield. It's still going to cause you some damage, bruising, maybe you might even break a rib, right? But you are not going to die. And hopefully that is the case, and that is now being shown as an evidence. And what is that? It protects you against severe disease, which can threaten your life 94, 95% of the time, even after 1 dose. Right? And you can look at the data which is coming out with Covishield will give you that protection. So we're going down to the age of 12 and maybe even lower than that. That's happening in the UK at the moment. We don't know if we'll have to do another trial, to show some safety in India. We might. We haven't applied to the regulator yet. I would guesstimate a 6-month time period for Covishield to be approved and proven to be safe in children below the age of 18, going down to maybe, 10 or 12 years of age. And then maybe later on, eventually after a year, even lower than that. But you see, when it comes to children, we want to be very, very sure in the dosage, in the safety, the way the vaccine replicates in the system. The children's metabolism and immune system is very different to an adult. So we need to go very, very carefully there. We don't want to take even a 1% chance of harming a child, in these trials. So that's why it's taking a little bit longer. So I know already some other vaccine manufacturers are proposing a third dose and doing trials to prove how much better that makes things. We are looking at it because at the moment, the data we have, that minimum 7 to 8 months protection with the 2 doses, after the 2 doses are administered, is there. Now we have that data coming out globally. They'll publish it soon. So we know that for certain. Now, after 8 months, we don't know because the time hasn't passed. The real way of proving that, I mean, is, waiting for that period to pass. So we've got data from the Oxford AstraZeneca vaccine from the very early patients and trial candidates and others that were vaccinated, 7-8 months ago. So we're waiting to really know and answer that question as time goes on.
Adar Poonwala, you've been the cynosure of all eyes over the past several weeks. 60 million doses being produced at your facilities in comparison with 4 million at your competitors. That's the gap. So, about 95% of the people getting doses at this moment are likely to be getting one of the vials coming out of your facility. How have these few months been for you? Individually, institutionally, for your family and for the team at Serum?
Stressful would be an understatement, because it wasn't just the stress, it was the uncertainty and unpredictability of every week throwing new challenges, issues, whether it's a lawsuit, whether it's some controversy on the product, whether it's some permission, whether it's an issue of the raw materials, working till late hours of the night on conference calls, that challenge and that work that the entire team and my family went through for the last year, I would not wish it upon anybody. And I just hope that we as a community, as an industry, are better prepared in the future. And we've learned so many lessons that we'll be better prepared for this kind of situation going forward. And I'm just so relieved that things have now worked out so well after all the risks we took early on, for which we're able to do this today. And every employee is just so happy and proud, but still under tremendous stress, don't forget, because even one batch failure or one issue with the manufacturing facilities, could be detrimental to the India supply, to the global supply. So that stress level is, still up there even today, and it continues with all these new candidates. So, whilst we wait for all this to be over, there's also a moment of relief and satisfaction and gratification that we have, that we've been able to deliver this to our nation and to the world. And, we're thankful to the government and everyone who's played a role in helping us get there, including the public that has been extremely understanding and patient with all this stuff that's been going on.